Here's Roxanne Stein.
Carotid artery disease can lead to stroke, but the question is, who's at risk? Dr. Steven Servas of Boca Raton Regional Hospital joins us to talk more about detection and treatment. Thank you so much for your time this afternoon. First of all, what is the carotid artery?
Well, carotid arteries are blood vessels that carry blood from the chest through the neck to the brain.
Is it a silent killer or disease? And what happens here when they become clogged?
Well, carotid arteries become clogged with what's called atherosclerotic plaque. Atherosclerotic plaque occurs when cholesterol and inflammatory debris is deposited within the walls of the arteries. The more of that plaque that builds up, the less space there is for the blood to flow. Once that plaque is in the artery, either blood clot or cholesterol debris can be picked up by the blood flow and travel to the brain, causing stroke or mini-stroke. The symptoms associated with stroke or mini-stroke could be loss of vision, inability to speak, or inability to move either arm or either leg.
So those would be the symptoms, and how do you determine if it's the carotid artery that's clogged?
To detect carotid artery disease, there are a number of strategies. One, your physician can place a stethoscope on the neck to listen for the sound of turbulent blood flow. That's called a carotid bruit. If you suspect carotid disease, the best first-line test is a carotid ultrasound study.
Now, is that long and involved? What kind of a test does it involve?
It's a very easy study. It's non-invasive. If indicated, it's covered by most insurance plans. It probably takes about 10 or 15 minutes total.
So treatment is what?
Every patient with carotid disease should be considered for medical therapy first. That includes aspirin or Plavix to reduce blood clot formation on the plaque, and it includes cholesterol medications to reduce the amount of plaque. Once a carotid blockage becomes severe enough, it needs to be fixed, and it can be fixed either with an open surgery or placement of a stent.
Now, Dr. Servas, can something like this be prevented?
It can. The risk factors for carotid disease are similar to heart disease: smoking, high blood pressure, high cholesterol, and family history. Although you can't prevent your family history, you certainly can stop smoking, make sure your blood pressure and your cholesterol are well controlled.
If you have coronary artery disease, are you at risk for carotid artery disease?
Yes. Atherosclerotic plaque tends to build up throughout the body. So it will occur in the heart arteries, carotid arteries, even the leg arteries, which is termed peripheral arterial disease. So if you have disease in one location, chances are you may have disease in another location as well.
And we'll let that be the final word, but any symptoms that you mentioned, you should see your doctor immediately. Dr. Steven Servas, thank you so much for your time today. Boca Raton Regional Hospital sponsors our expert and also sponsors our Ask the Doctor segment. We're back with more in just a moment.